And here is your host.
Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker, and I am so excited that you have joined us for this week's program. You know, when most people think about health, they think about the doctor's office or a hospital, medicines, maybe even the gym. But today we are talking about something much closer to home. And I mean that quite literally. We're talking about the place where we sleep, where we raise our kids, where we gather with our family, and where we expect to feel safe. The place we call home. Because here's the reality. Health doesn't actually begin in the doctor's office. It begins in our communities, and more directly, it begins in our housing. So, if you live in a home, have lived in a home, aspire to live in a home, let somebody know to tune in today's broadcast, because we are going to talk about what it's like to live in a home, and particularly the air inside. For many folks, the air inside their home isn't actually their own. And so we're going to talk a little bit about smoke from neighboring units, how that can come in through the walls and vents and hallways and other areas. And we're going to talk about how this impacts folks living with asthma or heart disease or other kind of conditions. And that's why this conversation really matters. So text your friend group, put it on social media, let folks know that A Healthier Tomorrow is on the air. And as always, we are sponsored by the Southern Nevada Office of Chronic Disease. And we're so grateful for their support for the program. More on that later. So without further ado, I have two incredible, fantastic, powerful guests in the room with me today. And they're no stranger to this show or to you. But I do want them to introduce themselves. So, starting with you, Nellie, would you tell us a little bit about who you are and what you're doing?
Of course. Thank you so much for having us today, Will. I'm happy to be here. I'm Nellie with the Southern Nevada Health District. I'm a health educator there. I've been working in tobacco control policies for, I think it's been over 7 years now. So it's been a nice little run for me now. And working on smoke-free housing initiative. That's what we're here today to talk about. And so excited to bring with us today one of our great partners this year with Nevada Hand. Brittani, would like you to introduce yourself?
Hi, good morning. My name is Brittani Gray. I'm the Vice President of Resident Services with Nevada Hand, and I help support residents out of our 36 senior and family communities throughout the valley, maintain their housing, and ensure that they live well.
Fantastic, fantastic. And I have to admit, I'm a little biased towards Nevada Hand because I've done a lot of work with your community.
You are amazing. Thank you so much for what you do, and I'm so glad it's you interviewing us today.
Of course, of course. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Finding a smoke-free living space is easy through the online smoke-free housing directory. The directory has over 60,000 smoke-free living spaces listed, ranging from senior housing to luxury living. To view this directory, please visit our website at gethealthyclarkcounty.org. All right, Nellie, the Southern Nevada Health District Smoke-Free Housing Initiative isn't new, and it's been doing some incredible work for a long time. Can you tell us about that mission?
Of course. Like you said, it's not new. The Smoke-Free Housing Initiative is actually a partnership effort led by the Southern Nevada Health District to support healthier living environments in multi-unit housing communities. And our goal is very simple. It's to educate property managers and residents about the benefits of smoke-free living and provide resources that help both communities create a healthier space for everyone and residents as well.
Fantastic. Now, Brittani, Nevada Hand has what I consider to be a pretty unique mission and a commitment in our valley. Could you talk a bit about how you serve our residents through equitable housing practices?
Yes, so at Nevada Hands, our mission goes beyond providing affordable housing. We're committed to creating communities where residents can thrive. We focus on resident-centered practices that support stability, wellness, opportunity, and connection. Everything we do is rooted in listening to our residents, understanding their needs, and ensuring that they have access to resources that support and improve their quality of life.
You know what? As you say that, it reminds me of really the work we do with our community health assessments and identifying the needs that we have. We start with listening to the community, right? Mm-hmm. And then one of the things we really aim to do as we implement based on what we've heard is increase that access. So again, hand in glove here with what we're doing. Nellie, I want to talk about the nitty gritty.
Okay.
How does secondhand smoke in multi-unit housing actually impact us?
Absolutely. So we know there's a lot of myths out there, right? But I do want to clear one thing is that there is no safe level of exposure to secondhand smoke. We know that, right? Even just brief exposure can be harmful, especially to children, people with underlying diseases, elders. And so it really does affect people with asthma as well, like I said. And we know that there's a particular challenge in multi-unit housing that smoke really doesn't stay within the walls and boundaries, right? It travels. It can travel through vents, windows, air ventilation systems, holes, cracks in the walls, really anything. And so, again, this is why it's such a challenge, particularly in multi-unit housing communities.
Yeah. And speaking as a new father, I've got a 6-month-old at home. I can't believe she's 6 months. That's so wild. But there's also this hidden element. So I do live in a single family residence, so I don't have as much. Although when my neighbors barbecue, we definitely know. And my little air filters turn on and they're like, warning, warning. But anyway, there's also third-hand smoke, which is what's left over that we don't really smell or see. Can you share a little bit about that?
Of course. The third-hand smoke, it's the residue that's left over from the tobacco smoke, right? We know this happens a lot often when we have chain smokers smoking inside the unit. I've personally recall one instance when I visited a multi-unit housing community and there was a big challenge with smoking there. We did a little tour around the building and the property manager invited me to go into one of the buildings that had recently been vacated because the resident unfortunately passed away due to smoking, right? And so we went inside the unit and third-hand smoke all around. The walls were yellow. I think I was in there for less than 10 seconds and I had to immediately exit the unit because I couldn't stand the smell. It was so intense. And again, a lot of the times you can't smell it. This time you could definitely smell it. But the third-hand smoke, it's invisible in a way. It's there. You just don't see it a lot of the times. Yeah. Many times you can, though. Right? It's yellow.
Yeah.
It's yellow.
I remember touring actually one of the properties at Nevada Hand, and they were gracious enough to kind of show me firsthand, like, well, this resident just moved out, and they had taken a picture off the wall, and you could literally see the outline. Mm-hmm. Absolutely. Yeah. And it's for me, it's impactful not just for kids, but for pets, because they're the ones that are touching it in that paw-to-mouth action. It does impact us. So even if you're not a actual parent, if you're a fur parent, like I used to be, it matters to us too. So I want to throw this out to both of you because you have an incredible partnership around educating and outreach and really helping our communities to understand the impact of smoking. So would you share how this partnership kind of came to be and what you're doing?
Of course. I'll go first. We're lucky enough to partner this year with the Nevada Hand, knowing that they share many of the similar and common goals and objectives, right? And the mission statement is very similar to ours. So we reached out. We decided let's go ahead and, since they have this existing smoke-free policy, which they are doing a great job with their smoke-free policy throughout their communities, we said let's go ahead and highlight that this year. Let's make sure your residents are aware, which, just pushing out that message a little more. And so our partnership is really focused on providing and supporting residents through education, engagement. Together, we've participated in resident events, lunch and learns, outreach activities, right, that provide information about smoke-free living and available resources to the residents and staff.
Absolutely.
Right, Brittani?
Yes. So this partnership is great because it's what we're focusing on, right? When housing and public health organizations work together, like the Southern Nevada Health District provides support to our residents, education, sensation resources, it just helps bridge the gap, right? So Nellie was mentioning, our senior health festivals, our lunch and learns, our community planning meetings. Like we have someone to call on firsthand when we need support with marketing or just educating our staff and our residents as a whole.
And we've had great feedback. I love the feedback that we get with those presentations. We definitely appreciate that opportunity, because a lot of the times we don't get that direct feedback opportunity from residents, right, themselves. Oh, we didn't know that vape was a secondhand smoke concern as well now. Mm-hmm. So you're telling me my cousin who comes in here and visits me and smokes, the vape, that is also harmful. So that goes into a whole different conversation, and it's a great opportunity.
Yeah. Now, Brittani, don't be mad at me when I say this, but if someone brings their guest over and they start vaping, you gonna put them out?
Yes, you gotta go. We have a policy in place. No smoking in the units or common spaces. Absolutely. I'm not receiving any violations on behalf of my guests.
All right. I think it's so important, though, to meet residents where they are and to have this kind of open and supportive conversation. And again, this entire conversation, it's not about judging anyone, because we know that smoking is an addiction. Mm-hmm. And we also know that folks start and aren't necessarily aware of the health implications, or for vape in particular, they think it just smells good. They think it's just something fun to do. So can you share just a little bit more? And Nellie, I know you go and visit the properties and do this. Can you share why this matters to you personally?
Yeah, of course. I mean, like you said, it's really, we're not focusing on the actions and what people choose to do in their own private spaces, right? This is really a bigger issue. It's a social equity issue, and really we're focusing on ensuring that our environments are clean and breathable for everybody, right? That everybody has access to that fresh, clean air that they want in their own homes. So really that's where we want to get to, is ensuring that, people don't feel judged, right? It's not about that. It's really about ensuring everybody has a smoke-free living space where they can have children, visitors, elders, without having that, concern about the health.
Yeah, and Brittani, you aren't just saying, hey, you can't smoke in the unit. You're actually providing support through the process and helping folks to live healthier lives overall. Can you talk about that?
Yeah, absolutely. So we encourage that behavior change, takes time, and that every resident has a different experience or perspective. Our approach is just rooted on that respect, education, and support. Rather than telling people what to do, we focus on having a real conversation. Sharing information, ensuring residents know what resources are available to them is what my staff does on a day in, day out basis. And behavior change is hard, but talking and really explaining the consequences and things that, can jeopardize, them living well.
Yeah. And correct me if I'm wrong, but Nevada Hand is actually a nonprofit, is that right?
Yes, we are. Yes, okay. We are. So our resident services team is our extension of our nonprofit arm for our organization.
Okay, fantastic. So that allows you all to do some things differently, mm-hmm. and I think that's really special. I want to move to the bigger picture of community impact, because while we're talking about, individual homes, what happens in the home, the Vegas saying, what happens in Vegas stays in Vegas, we know it doesn't, right? That's very clear. So how does this actually improve our overall community?
So they make them stronger. I think sustainability is so important here with the work we do. Smoke-free housing helps create, again, like we said, cleaner, healthier environments where families can just thrive in the long run, right? Over time, these efforts contribute to stronger communities and help establish healthier housing standards across Southern Nevada, right? We, right now, I'm proud to say that we have over 68,000 smoke-free living spaces listed in our directory now, where people can go in, and if they're looking for a smoke-free place to live, they can check out our directory. All of the Nevada Hand properties are listed there, along with so many others that are now choosing to voluntarily implement smoke-free policies, which is what we want to do, right? And it's just creating that sustainability.
So, Nellie, if I'm a property manager or owner, and I'm listening to the show and saying, this would be really great for my properties, but I don't know where to start, what would you tell them?
I would tell them to visit our website, gethealthyclarkcounty.org. Also, there you will find all of the information. We have a toolkit, a 36-page toolkit that was specifically designed for the purposes of, implementing policies, whether you're in the process of just, maybe thinking about it, or you already have a policy and you want to go ahead and enforce it, because we know that's another challenge, right? Sometimes. So we have all of those steps in our toolkit. A property manager can go to our website, easily download the toolkit, or simply email us and request a toolkit. We'd be happy to provide them toolkits, resources, promotional items for free at no cost. Again, whether they're just thinking about it, we can help them through that process by directly meeting with them, providing them technical assistance, answering any questions we can, and then also, like we're doing with Nevada Hand, providing, resources, materials. We provided signage for free at no cost.
And they're quick.
And you say, and they're quick. Free and quick. That is awesome. I love hearing that. And Nellie, earlier you mentioned that there's no safe level of secondhand smoke. I want to just get off topic just a little bit, but it's on topic, I promise. When we're looking at even things like parks or the shopping malls or walking down the street, sitting at a bus stop, how can we help protect ourselves against the secondhand smoke?
Yeah. So the Nevada Clean Indoor Air Act did a great job, right, by protecting us from secondhand smoke in workplaces, places of employment, and other indoor places of where we live, work, and play. But obviously, there's still a lot of work to get done, right? Like you said, parks, outdoor events, venues. Sometimes, again, I have a 6-year-old and I like to go to the park sometimes with her. And unfortunately, that's where sometimes it gets tricky because, someone may be smoking nearby. But again, parks, outdoor events, if you're someone who's maybe planning an outdoor event and want to reach out to us, we work with outdoor event organizers as well to establish smoke-free outdoor events.
Okay.
Yes, that's something that we can definitely do. Work with you on that, and just to bring a more family-friendly vibe to the community, right? And again, you can protect yourself by obviously staying away at least 25 feet or 30 we recommend from anyone who's smoking or vaping. With this particular multi-unit housing communities, we do recommend 30 feet distance, no smoking within 30 feet of the property to create a healthier space. But again, with outdoor events or outdoor places, simply talking to community members and just making sure everybody's aware that, secondhand smoke is not healthy, right? It's a danger to everybody. So just providing that education community-wide.
That's so important. Thank you for sharing that. Now, I want to ask, let me start with this. I believe that housing is healthcare. And so as someone that's in the healthcare field, right, that's kind of my lens through for most things. But I'm curious, Brittani, your perspective on why partnerships between housing providers and public health organizations are so important for really long-term community wellness.
Yeah, absolutely. So we know housing and health are deeply connected, right? Stable housing creates a foundation for good health. Public health initiatives help residents live healthier. And then partnerships like this allow us to combine the expertises, resources, and community relationships to create a greater impact for both organizations and for individuals to achieve a healthier life overall. And I'm just so grateful to have this partnership because it's so important. I mean, we service over 8,000 individuals. Wow. And having this partnership, coming in and out, picking up the phone and just asking questions and just educating our residents and our staff is super important.
Absolutely. And I want to just dive a layer deeper. Why is this meaningful for you personally?
Ooh, I've never been a smoker. And, not being able to tolerate the smoke, right? Going into events or a casino or thinking it's no more restaurants, but it's important for my own health. I have girls myself, my children, the environment as a whole, and I just think it's a bad habit.
Yeah,
it's a bad habit.
Thank you. All right, Nellie. So one more time, what are the resources available through Southern Nevada Health District to actually help people quit smoking?
Of course, yes. So the Southern Nevada Health District offers a variety of free resources, including, like we mentioned, educational materials, technical assistance for housing providers such as managers, and, like you mentioned, tobacco cessation resources for those residents who are interested in quitting smoking. Because a lot of the times, we do want to ensure that there is that available additional support beyond promotional materials and signage. If a resident is ready to quit, we are there for them, right? We can help them. And again, it's all, my favorite word, free.
Yeah.
It's all free, which is great. I love saying that, but it's true. And if it's there, why not take it, right? Our goal is to make sure individuals have access to the support they need when they're ready to take that next step. So we do partner with the Nevada Tobacco Quit Line to offer these cessation services through the 1-800-QUIT NOW. That's 1-800-784-8669. That's the number to call if anyone's ready to quit. Take that first step.
Fantastic. And just for anyone wondering, when you call, you don't actually have to quit now. It's just a great way to remember the number.
It's a process.
It is a process. And Nellie, on average, how many attempts does it take for someone to successfully quit?
Ooh, that's a good question. Many.
Many.
Do you know the exact answer to that?
It changes.
It
does, but up to 15 is pretty average. I'll say, for example, my grandfather was a smoker for years. He was an Army vet and then played basketball, became a basketball coach. And then his doctor's like, look, you have two options. You can quit smoking or quit breathing. It was that clear. And so he had to quit, but it took him many tries, and he had to use the tools like smoking cessation medication in order to finally quit for good. And so he's been smoke-free for over 20 years.
Yay!
Yeah. And so my first attempt was I threw his cigarettes in the pond. Anyone listening, that doesn't actually work. It doesn't help, and it hurts the little fishes. So don't do that. But 1-800-QUIT-NOW is a great resource with folks that are trained to help you through the process, to help you establish a plan, because if you have a plan, then you can execute. And my favorite part of the plan is that you give yourself a reward for hitting your milestones. I like to treat myself. So that's a great way to do it, right?
Save money, too.
And you save a lot of money. You save a ton of money. Smoking is so expensive.
It is.
But I want to thank you both for joining the broadcast today. We're not quite done, but I do want to share that the Southern Nevada Health District is offering another shop talk on Thursday, June 25th from 5:30 to 8 p.m. at the Art of Barber School inside the Boulevard Mall, one of my favorite places. Shop Talk is a free community event created for Black men to connect, be empowered, and invest in their health. And it will be moderated by Sweet Lou Collins. Connect with health professionals for real conversations about heart health and taking charge of your wellness at every age. Enjoy a complimentary headshot for a picture-perfect health. Register now at gethealthyclarkcounty.org. And I'm just going to add, they said free complimentary headshots. That means y'all don't have to use AI to make your headshot now. Go to the Shop Talk and get a real one. Okay, thank you. Back to our regularly scheduled program. Brittani, Nellie, I'm curious, what are you all doing personally to stay healthy, especially as we get into this warmer weather?
Yeah, I'm doing, I took up a little bit of Pilates and yoga on the weekends, and I think that's something that I get to do for myself, right? Because again, like I said, I'm a mom of a 6-year-old, and all my attention goes to her still. Yeah. I thought it would change a little bit. It hasn't. I said when she gets older. Mm-hmm. So I realized, you know what? Now is always the time to do it. Just like I tell people, now is the best time to quit. Now is the best time to take care of yourself, right? Absolutely. So that's what I'm doing a little bit more.
I love that. Brittani?
I'm staying hydrated.
Okay.
Right? In this heat, drinking a lot of water. I'm going on some walks. I am re-engaging myself back into fitness. I'm getting, try to stay fit. So I enrolled in a fitness class. So just trying to stay healthy. My kids keep me busy as well too. But hydration is my number one goal for me for the summer.
Oh, that's so important. So here's one of the things I love to do. I like to try different herbs in my water. So the mint, the oregano, actually I found was surprisingly delightful. It was a different flavor than I expected, but it was really lovely. And then also, of course, the traditional cucumber in the water and pineapple in the fruits and that sort of thing too. But I just experiment. I make it a game. Some of it's not as good as others, but I try, and that's how I learn. But hydration is so key. It helps with, overall health, but also just clarity of thought, being able to think. If you're not hydrated, then it's harder to think. And heat actually is a major impact for health, so it's important that we take those steps. And then you mentioned the physical things that you're doing, and you mentioned like Pilates, and I think you said yoga, right, Nellie?
I did.
Okay, let's talk about the mental health piece, because that's so important important too.
Yes.
What are you doing for your mental health?
The same thing. It helps me
Yes.
so much for my mental health, honestly. I didn't realize it until I went a couple of times. And, with these classes that I'm taking, the instructor just tells you to take a deep breath, be connected, be present. It's so important. Sometimes we're so caught up thinking of what's next, what do I have to do next on my list? You're never fully present. And I'm like, that's right. Enjoy the moment, take a deep breath, and just, be present. And I've really been able to apply a lot of those same concepts to work, to everyday life, to parenting, and that's really helped my mental health. I know we just had mental health month last month, and I said that's so true, right? It's something so important that all of us sometimes tend to forget a little bit, but that's what I've taken from that.
I love that. Being present is so important, especially in this age where so much is vying for our attention. And if you can just choose, and I'm learning this from my daughter, right? If you can just choose to be fully engaged in what you're doing, it makes such a positive impact on your mental health.
Absolutely.
Brittani, what about you?
Ooh, I take a moment, put the phone down, put it on D&D. Sometimes I drive with no music on, and I'm just, the windows are rolled down. I'm just, just thinking about, how the day went. What do I have planned for ahead? What am I making for dinner? So I really try to disconnect and be present, like Nellie was mentioning. It's important, and time goes by fast, and you don't get time back. So just realizing that it's important to take care of yourself, take care of your family, mind, body, and soul.
Love that. And being present for yourself is actually helpful for others too.
Absolutely.
I was looking at a study recently, and I'm not going to get too academic, but it was talking about the fact that the way to, whether it's work or at home, the way to actually improve health isn't in isolation. It is in community.
Oh, yeah.
Mm-hmm.
And so I love that you bring that piece. Last thing I'll share, I just want to shout out, it is Community Health Week. And so I want to just shout out all the people and recognize all the partnerships and programs that are working every day to improve health where it happens, which is in neighborhoods, it's in schools, workplaces, and homes. Community health is more than just treating illness. It's about preventing disease. And Nellie, I think that's the work that you're doing, and Brittani, that's the work that you're supporting here. It's addressing those barriers to well-being and creating the conditions that allow every person to thrive. So thank you to the community health professionals, Nellie, Brittani,
Thank you.
and all the advocates and partners who are helping build a healthier tomorrow for everyone. Before we sign off, any last things that you'd like to share with our audience?
I think just at the end of the day, I think we just want to all, again, work towards a healthier community, like you were mentioning, Will. And for our purposes of this initiative with multi-unit housing, is knowing that the foundation of Smoke-Free Housing Initiative is to provide clean air for all, and that everyone deserves to breathe clean air in their home.
Absolutely. I agree with Nellie. Just want to just recognize and say thank you to my staff for what they do, because sometimes that day-to-day interaction with individuals and going through crises and things, the work isn't easy. So I really want to shout out them and tell them thank you. And thank you for having me on the show, Nellie.
Thank you for your partnerships.
This has been A Healthier Tomorrow. I'm Will Rucker, and as I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop, and what you do matters. So live compassionately and tune in next time.